All right, everybody, welcome to our webinar about RFQs and telemedicine. With me is our VP of Customer Success, Messias Soares. We thought of hosting this webinar because we have been part of applying, mostly winning, some losing, interesting RFQs around telemedicine. With the significant funding opportunities from the US government in the US around the Rural Telehealth Transformation Fund and globally around advancing global health, we've seen more and more and more telemedicine RFQs being issued. And as we have looked at them, what we noticed was a lot of them tend to be backward looking or asking for sometimes the wrong set of criteria and not asking for the right set of criteria. We have experience building the world's most advanced rural telemedicine deployments and deploying telemedicine mostly successfully. A few deployments were not successful in the US. So we thought of sharing some of our lessons around what does it take to have an RFQ for telemedicine that helps you as a healthcare organization deploy successful telemedicine? We will also be sharing with you afterwards a template based on some of the successful RFQs that we have edited based on the content we'll discuss today. So anybody interested afterwards in a Word doc file that you can go and edit, modify to your specific needs in your own country or state or healthcare organization, we will share those with you after the meeting. Messias, shall we get going?
Yeah, yeah. No, also just want to say thank you for everyone joining. I think this, as you said, it is happening in the US and worldwide. We see some names and identify folks from the registration that are outside of the US, and we see also the growing number or RFQs happening in Latin America, in Africa, in the Middle East. So again, this serves not only for the US market, and the idea, as you said, is to get some sort of like a template that folks that work in healthcare organizations can use, but also partners that can help healthcare organizations or governments that are putting together RFQs. But I think, yeah, we're going to cover most of these on these next slides.
So the first thing that we really want to emphasize is an RFQ is a critical tool to get the right vendors filtered and let you partner and find the right vendor. It's the right process. But if you do it right, it's really help you determine a successful deployable solution. It lets you filter between vendors' claims to actually track record, and a good RFQ is a great tool that let you surface and get the right issues. A bad RFQ, if you don't ask the right questions, is extremely difficult to fix later on. So it's important to pay attention to the RFQ and what content you put in it. This is an example of some of what we call things in the RFQ that probably do not really matter and are asking for the wrong thing. Everything from it needs to have an i5 CPU to trying to apply the wrong electromagnetic compatibility standards. These are things we often see inside. A lot of those are really not as applicable. For example, by requiring an i5 CPU, you're really speccing it to be a Windows machine. Is Windows the right solution or not? Is the focus on the processing power, on the actual experience of video call and telemedicine? These are just some of the examples of RFQs that have some of the wrong questions in them.
Yeah, and sometimes we see that people are narrowing down the options as we see here, that really this limits the capability of what you can do. But also on the other hand, in other more important aspects of an RFQ, they don't ask the right questions and they are like not as specific on things that really matter. So again, this is like real world examples of RFQs that we as a company we've seen in the past and really wanted to use as again as an example of how ineffective they can be because yeah, in terms of an RFQ and being effective, these are not the right questions that they need to ask.
So what are the right questions? Let's get into it. We are going to do it relatively quickly, but if people have specific questions around them, uh, let us know. So, um, the current requirements, what vendors need to demonstrate or should demonstrate, um, some advice around the procurement process and questions, and some lessons we have learned. Let's get going.
Yeah, this is the template that we'll be sharing with the attendees. It's a multi-page with all the sections, and we really invite people to comment, also give suggestions, but if needed, to copy and paste into their RFQs because this is addressing the telemedicine requirements that we believe are important.
All right, so there are 7 topics we are going to cover today. Uh, Thinking about form factor and diagnostic devices, think about use case and online versus real time, the training and the usability of the solution, how do you manage the deployment, how do you deal with cybersecurity, what's the business model and how do you align the incentives, and AI. Let's get going on the first one. Um, when you deploy a telemedicine solution, this is not a cheap undertaking. The use cases that the telemedicine is used for, is it used for pregnancy? Is it used for pediatrics? Can it be used for more use cases? Can you expand the use cases with time? The critical part here is thinking through what diagnostic devices is the solution supporting. And it's not just what you want right now for your short-term deployment. It's what are the devices you might need later on. The more devices you are able to support, the more use cases. The more use cases, the more cost effective it is because you're dividing the costs on different use cases. So even though you might start at an early point just saying, oh, I just need a blood pressure or pulse ox, uh, is this a platform and an area that you plan on expanding to other use cases? The other side of it is the form factors. Do you cover only a telemedicine cart? Do you also want it to be mobile so people can take it in a backpack to visit patients' homes? Does it need to be installed on a vehicle so you can drive around like we've seen in the Mexico federal government? Or is it fixed inside a remote clinic? Thinking through different form factors uh, is also critical because, again, you might be starting with a specific use case right now and specific form factors, but what you don't want to do is end up in a scenario that you have 5 or 6 vendors for different form factors and different devices. So carefully think through in the RFQ and ask the vendors to testify to different form factors and support of different devices. The question on the devices also touches on Ours is the vendor-specific devices, so they have a incentive to push their own devices, or are you able to integrate different innovative devices from around the industry? Uh, Healthcare is such an innovative, big industry that very few vendors are able to excel in all the different devices. So an open device platform is critical for being able to have confidence in the different devices and the use cases they support.
Yeah, and given also again bringing the international approach, if it's innovative, healthcare is innovative but also regulated. So sometimes that decision when you go to a different country to understand that devices that are already approved in a country that can be integrated with the platform, sometimes they represent an easier path, right, to get the deployment going instead of going through the whole like regulatory pathway within a country. So it's both for having more options, but also from a regulatory perspective, it helps you seeing what you have currently in the market. Sometimes that's going to be playing into the decision.
Let's move on. The other side of it is real time and offline. Do you require the telemedicine schedule to be scheduled ahead of time, calendaring? Do you require them to be immediately start and have direct access to the devices while and the vital signs while the telemedicine session is in progress? Do you support an offline mode where a health worker can collect the information offline and then let the doctors access them when the devices and the telemedicine station is online? Careful thinking through the use cases, as well as are you limiting yourself to specific use cases, or do you need to support multiple use cases like real-time, offline, and async?
And again, we know in Latin America, connectivities, it's not always reliable. So having a platform that allows you to, it doesn't mean that you don't have to collect information and data and still, seeing your patient if you don't have connectivity. The idea is, yes, you have a platform that even in these challenging conditions, you can still, send or collect information. It could be healthcare forms, admin forms, and of course, all the diagnostic devices and using the sensors that are part of your portfolio and manage patients. So again, this should not be related to connectivity if you have a platform that works both ways.
Ease of use is hard to quantify, but ease of use makes a lot of difference. In many industries, and I'm coming from the mobile industry, and I have seen firsthand how products with amazing technologies and capabilities that mark all the check marks fail because they were not easy for use. Things like latency. How long does it take the software to react? How many steps does the operator need to take to achieve a specific goal? You can measure those, you can put requirements around it, but ease of use is absolutely critical. And when you get it right, it drives usage. If you didn't pay attention for it, doesn't matter what you have on any of the other requirements. Uh, if the health workers are not using it or the nurses are not using it, it's throwing money down the drain. So think about how you check about ease of use.
Yeah, and we've seen more and more, even in the US. I was just in a conference last week and people were talking about community health workers, although internationally we see that term, more often. In the US, we started to see more and more this term because yes, healthcare organizations need to use existing resources, and your existing resources, sometimes in rural areas will be a community health worker. So I think the ease of use, helps one, how quick you can start process, though? How was the training process? How does that look like? It's not subjective, right? The vendors must prove that they have a platform that enables something to happen quick. But also, once this is deployed, ease of use means more usage, and we know that this also impacts, how sustainable and scalable like a project should be. So again, just wanted to mention the community health worker option that is again is becoming across the globe, including the US now.
That's a really good point about the healthcare moving to health workers. Uh, Nurses and doctors are too expensive of a resource. And with the emergence of AI that can support a 18-year-old, 20-year-old health worker with lower level of training, the capabilities and what a health workers can do is uh, becoming transformative to the healthcare industry. And that's why we are seeing it now more and more in the US, not just developing
Yeah,
countries.
correct.
So the next question is about deploying it, because uh, the last thing you want to do is having to deploy a wonderful telemedicine system with an IT support person shipping to each location. So does the solution enable you to configure, monitor, and manage the deployment remotely? Debug it if something is not working, change Wi-Fi network, install new applications. And is it done without accessing patient data? That's absolutely critical. You do not want your telemedicine vendor to have access to all the healthcare data on your deployment. For privacy, security reason, it's the wrong approach.
Yeah, even the
You do need a deployment management solutions that let you use the cloud to properly manage your deployments.
and even the IT within an organization, right? So at different roles, you're gonna have your physicians that will need clinical information, absolutely. But you also have your IT team that, or admin staff that needs access to the platform to manage and to have visibility. And again, that platform is separate than the clinical platform. And again, that, an admin system to give visibility and generate reports, change configurations, make sure you identify problems earlier in the process. I think this is again key, not clinical, but still very important for a successful deployment.
Related to it is cybersecurity. In general, we see two different generations of solution, Windows-based and Android-based. And cybersecurity in both of them is radically different. Uh, the tablet-based Android are using much more modern technology, and because the phone industry and the mobile industry is so sensitive to cybersecurity and privacy, it tends to have a higher level of cybersecurity built in. But the next level of it is, how do your users log in? Is there an enterprise uh, mobile management platform to configure and protect your tablets or Windows? So fully understanding the cybersecurity and device management is critical. Business model is something I am very passionate about, because I believe that if you are able to align the incentive of the vendor to the incentive of the health organization, you will have successful deployment. If you are just trying to buy a product, the incentives are not aligned. The incentives of the vendors are to keep on selling you a product again and again and again for the highest cost. If the business model is around service, the incentive of the vendor is to verify you have a successful deployment. So within a year or half a year, you expand the service to extend longer. So carefully think through the business model and verify that it sets the right incentive. When the incentives are properly set, the details in the specification sheet don't matter as much because the incentive of the vendor is to keep on updating, changing the capabilities, increasing um, capabilities, removing obstacles, and these always come up. But if the incentive of the vendor is around service, then the, you don't need to have those in the spec. The vendor will go and get those things done because they want to verify the contract is extended and service is paid.
Yeah. And there was a reason why Rom decided that I'm customer success and not sales within 19 Labs is I think it speaks to how obsessed we are with utilization, right? And this starts right after a contract is signed. So for us, I think what's very important is to understand that like it's only an ongoing partnership makes sense for both sides to be aligned when it comes to the incentives. We know, especially in the public sector, sometimes there are like allocations for equipment and services that might be different. In some cases, when we've had that customers requesting some sort of a leasing model that is, hardware as a service, you name it. And again, regardless of the option, that sometimes this is related to the customers and how they plan it, but only an ongoing business model makes it that both sides move forward, right? And again, what we don't want is to sell, at least in speaking on behalf of 19 Labs, is to sell a piece of equipment and that's done, right? So what we really want in our business model, we want the product, like the hardware, to be as affordable as possible. So the services is also affordable. So once you pay for your infrastructure, maintaining a program, a telemedicine program, should not be, like a hard lift. So the idea that we are obsessed comes with that. The more you use a platform, the cheaper it gets, right, per usage. So that's the mantra that we have here. Speaks back to the diagnostic devices that we mentioned on one of the first slides. What is the idea behind? Once you have more uh, medical specialties around, you can see more patients. The more patients you see with the same platform, like the cheaper it gets per visit, if you need to put a metric around that. So, but again, for those of you, and I see that we have some partners also joining us in this webinar. You guys know how we try to be engaging and making sure that we don't only sell a piece of equipment, but we make sure that they are using these devices and keep growing, and that we can manage, report, generate information around that, so everyone involved in a project has visibility. But yeah, so it's we are obsessed, and every vendor on the telemedicine space should be as well.
So this is something that I'm feeling very passionate about. And in the last, I would say, 18 months, we have transformed both our internal working as well as customer interaction and the products to think through AI integration. Uh, what we've seen often happen, even in the most remote places on Earth, is health workers, nurses, doctors will pull up their phone, go to ChatGPT and ask health questions. This is happening. You can't fight it. What you want to verify as a healthcare organization that AI is integrated into your telemedicine, because otherwise it's ChatGPT on the operator phone, and that you're able to customize the AI to follow your own policies. Uh, this, in my opinion, is one of the most important parts of the telemedicine because that directly affect the costs. If a health worker is able to get your own health assessments based on your own organization policies directly from the telemedicine, it drives your telemedicine service costs down. And some people might say, well, I'm not so sure, healthcare, AI, not ready yet. Well, um, these voices are valid, and there have been problems with AI in healthcare. But the speed in which this industry, the AI industry, is moving is so fast that these problems are addressed within weeks. And we've seen major vendor, Amazon, for example, launching a whole healthcare organization based on AI and telemedicine. So AI integration is a must for any telemedicine RFQ.
But not just the, checkbox as we have here in white matters, exactly how you said it. It needs to be integrated and useful, right? And think we have a slide after this one that shows how we see AI working along with the telemedicine platform. But the importance is, there are many ways you can be useful from an AI perspective, from the AI agents that are customized with your healthcare guidance to smart intake, the actual sensors that are integrating AI to help in the diagnosis, right? Not replacing the doctors, but kind of creating preliminary interpretations that will streamline the process and save time. So again, part of what we have is, some AI-backed sensors that are also part. So again, from the sensors perspective to the intake and also how you manage or throughout a patient journey, I think it's very important. I mean, the take
So
here is
we're
that,
going to give you a preview here of something we are about to launch.
yeah.
And yeah, I know of at least one other telemedicine vendor in the industry that has announced a similar integration. So if we move to the next slide, this is a visual to give you an idea how health agents are getting integrated into telemedicine. They have access to the vital signs, to the specific case and description. You can decide if this is anonymous, if you want to upload the data. Obviously, it's deleted in the end, or it can be uploaded to your medical record system. But being able to use AI with all of the data from the vital diagnostic devices and the interaction with the user is absolutely a must for any telemedicine solution that's going to be deployed in 2026 or 2027.
Yeah, I think as we've seen the AI, and I understand some of the perspective around AI in healthcare, but the in the pace that things are moving, this is already a reality. And using AI to actually support your, decision, I think that's the best use case. What we are trying to do here, and then again, you guys will see, and hopefully soon we'll be able to test, is how AI empowers and helps throughout a patient journey. So you have a patient in front of you. If you're a community health worker, so many questions that you can ask that sometimes not necessarily will require like a doctor visit, but also, if you require how, which questions you should ask your patient to make sure that when the provider joins, provider also has a full picture of what's going on. So again, it's a companion, right? Is how people are seeing it. And I think that's the best use case. And this is, again, already a reality. It's not something that we're planning for the future. I think in terms of, yeah, the all the 7 points were addressed, right? If we had to put what, RFQs where they go wrong and based on, again, our experience in the US and outside of the US. And I was just running into like an issue in with an RFQ in another country that they were looking for a computer and a web camera, right? That was the whole RFQ around. And now they're trying to fix that and adding diagnostic capabilities to the telemedicine. But it's just complex and time consuming and expensive to fix a poorly done RFQ. That's again part of what we wanted to have this discussion and hopefully to impact some folks working and writing RFQs out there. So again, the training video or the treating video as a whole solution was one of the highlights from what we saw as things going wrong. Same with connectivity. And again, I know in the US, a lot of places are still struggling with connectivity, but this is even more prominent outside of the US. So for the partners here that are part of healthcare organizations, governments, or are distributors in Latin America, Africa, Middle East, we know how connectivity impacts a successful deployment. So having that in mind and making sure that a platform can work under those challenging circumstances is going to be very, very important. Yeah, the two last points, again, the training and turnover, again, just to wrap this up, training is no minimal. And again, the idea is it's not a minor task to have your team trained. You need to have something that allows your existing resources to use it, the technology, so you can start quicker and make sure that usage is high. Um, and again, on the vendor side, being an open platform allows you for not only your current deployments, but what you're planning for the future. So being device agnostic and form factor agnostic helps you go a long way.
One of the most important questions that often not asked in technology RFQ is really asking for references, asking for outlining a similar deployment. What was the timeline? What were the costs? What were the milestones? And make a one-page executive summary of a similar deployment the vendor has created. I've seen this in a recent government RFQ around medical records that was hundreds of irrelevant questions, but the most important questions around reference and overview of a similar deployment with schedule, costs, milestones, and issues was never asked. And in my days at Apple, building the relationship, talking to the vendors and understanding the reference and similar deployments they've had is one of the most critical part to ask in an RFQ. Government RFQ are notoriously bad when it comes to it. In the idea that government has is that they should never talk to vendors because it might mean that it's unfair. And this often leads to some of the worst RFQ decisions I've ever seen. At Apple, at Samsung, I will never dare signing a contract without building a relationship with a vendor, meeting them, understanding where they come from, checking the references of what they give me, as well as what you can figure out without them. So we are very much a believer that when there is an RFQ, you want to invite vendors to come present to you, see how hungry they are, how detailed they are. Do they promise everything, or do they actually take time to think through on specific issues? This is part of the process and should not be neglected.
And yeah, so as we say, connecting the dots here, there's very important topics to be aware that exist and that should be considered in these RFQs. Important to what you said, Ram, I really agree that, especially in the government bids and RFQs, we do need to have, a more open relationship with vendors, right? And if I'm in the government, I need to welcome vendors to come and present their solutions. That shouldn't be any drama around it. And I think that's a mature relationship, things that we need to do, and it will only benefit a government and all the healthcare projects.
With that, thank you everybody. Appreciate you joining us, and don't hesitate to reach out if you have any more questions.